Truth about sexually transmitted diseases. Sexually transmitted infections (STIs), also referred to as sexually transmitted diseases (STDs), are infections that are commonly spread by sexual activity, especially vaginal intercourse, anal sex and oral sex. Many times STIs initially do not cause symptoms. This results in a greater risk of passing the disease on to others. Symptoms and signs of disease may include vaginal discharge, penile discharge, ulcers on or around the genitals, and pelvic pain. STIs can be transmitted to an infant before or during childbirth and may result in poor outcomes for the baby. 1-8 Some STIs may cause problems with the ability to get pregnant. More than 30 different bacteria, viruses, and parasites can be transmitted through sexual activity. Viral STIs include genital herpes, HIV/AIDS, and genital warts. While usually spread by sex, some STIs can be spread by non-sexual contact with donor tissue, blood, breastfeeding, or during childbirth. STI diagnostic tests are usually easily available in the developed world, but this is often not the case in the developing world. The most effective way of preventing STIs is by not having sex. Some vaccinations may also decrease the risk of certain infections including hepatitis B and some types of HPV. Safer sex practices such as use of condoms, having a smaller number of sexual partners, and being in a relationship where each person only has sex with the other also decreases the risk. Circumcision in adult males may be effective to prevent some infections. During school, comprehensive sex education may also be useful. Of the most common infections, syphilis, gonorrhea, chlamydia, and trichomoniasis are curable, while herpes, hepatitis B, HIV/AIDS, and HPV are treatable but not curable. Resistance to certain antibiotics is developing among some organisms such as gonorrhea. In 2015, about 1.1 billion people had STIs other than HIV/AIDS. About 500 million were infected with either syphilis, gonorrhea, chlamydia or trichomoniasis. At least an additional 530 million people have genital herpes and 290 million women have human papillomavirus. STIs other than HIV resulted in 108,000 deaths in 2015. In the United States there were 19 million new cases of sexually transmitted infections in 2010. Historical documentation of STIs date back to at least the Ebers Papyrus around 1550 BC and the Old Testament. There is often shame and stigma associated with these infections. The term sexually transmitted infection is generally preferred over sexually transmitted disease or venereal disease, as it includes those who do not have symptomatic disease. Risk factors for sexually transmitted disease. The risk factors of sexually transmitted disease include unprotected sex. Vaginal or anal penetration by an infected partner who isn't wearing a latex condom significantly increases the risk of getting a sexually transmitted infection (STI). Improper or inconsistent use of condoms may increase your risk. Having sex multiple partners. The more people you have sexual contact with, the greater your risk. This is true for concurrent partners as well as monogamous consecutive relationships. Anyone forced to have sexual activity dealing with rape or assault will be difficult. However, it is important to examine a doctor as soon as possible so that you'll be able to receive screening, treatment and emotional support. Misuse of alcohol or recreational drugs. The substance of misuse. Alcohol or recreational drug can inhibit your judgment, making you more willing to participate in risky behaviors. Being young. Half the sexually transmitted infections (STIs) occur in people between the ages of 15 and 24. Treatment for sexually transmitted disease. Sexually transmitted diseases (STDs) caused by bacteria are generally easier to treat. Infections can be managed but not always cured. If you are pregnant and have a sexually transmitted disease (STD), getting treatment right away can prevent or reduce the risk of your baby becoming infected. The recommended treatment for sexually transmitted diseases (STDs) varies, depending on what sexually transmitted disease (STD) you have. If you like the video, give it a thumbs up and share it with your friends. If you want more insights and tips, don't forget to subscribe and click the notification bell for updates.